When it comes to living a healthy and full life, preventative care is key, and regular checkups can be potential lifesavers, especially if they catch potentially deadly conditions early when they're easier to treat. Joining me now is Dr. Jonathan Steele with Providence Healthcare Clinic, and with talking about what physicians are recommending for men of all ages.
Andrew, it's a big problem, especially for men not getting screened. They are almost twice as likely not to get regular routine screenings. They only go half as often as women do, and they have many health problems, and they often go unignored because of that.
And speaking of some of those different age groups, when do you think men should start going to see their physician about these things?
You know, I would actually start at when you become an adult at 18. So there's recommendations at 18 are to get yearly blood pressure screening. So even if you don't think you have high blood pressure, you may not have any symptoms, still need to get seen, checked by your doctor at the clinic with the blood pressure cuff. Other things to be checked for at that age are like sugar. So you need to check if you have diabetes, especially if you're obese or you have hypertension. Skin exams are, although not a routine recommendation, are something to talk to your doctor about, looking for skin cancer. So and then also, of course, cholesterol screening, that actually starts at 18 too, if you have obesity or high blood pressure. So it all starts at 18.
Oh, wow. Well, they say an ounce of prevention is worth a pound of cure, right?
Amen. That's very true.
So you see a lot of women's clinics everywhere. What about, men's clinics? Where do men go?
Well, I would start, if you're a man and you are wanting screening, preventative testing, everything like that, start with your doctor. There are men's clinics. Urology clinics certainly provide care more tailored towards men, although obviously not exclusive to men. But your doctor is the place to start.
Can you talk about some of the different things that you see in different age groups of men?
Yeah, so between 18 and 39, we talked about the screening for that, blood pressure, cholesterol, diabetes, those are the big ones. Over age 40 into 50 is when we start talking about more cancer screening. So prostate cancer, that's a conversation to have with your doctor about whether or not to get a prostate check or a PSA level. Colorectal cancer, that's usually starting at age 50, unless you have a family history of it, then it's a little bit earlier. And that can involve a colonoscopy, but it's not the only option. So if you don't want a colonoscopy, there are other options. And then also still doing the blood pressure screening, the cholesterol, that's really important. Smokers over age 65 need to get a certain kind of screening to make sure that they don't have lung cancer. And that's critically important. It's actually between 55 and 80. And then also hepatitis C, that's a big one for people born between 1945 and 1965. So there's a lot involved. It may just come down to once a year though, so if everything's okay, but do the screening. It really does prevent a lot of problems.
Great, well, great recommendations. Thank you so much, Dr. Steele.
No problem.
I appreciate you.